Hi there! Today, we are going to talk about my autobiography as agents for HIV and AIDS. My generic names are efavirenz, tenofovir, emtricitabine, ritonavir, and raltegravir. My brand names are Sustiva, Viriad, Velidi, Emtriva, Norvir, Isentress, and Atripla.
This is my chemical name.
Next is drug classifications. Under therapeutic classification, I am a non-nucleoside reverse transcriptase inhibitor, nucleoside reverse transcriptase inhibitor, protease inhibitor, and an integrase inhibitor. Under my pharmacologic classifications as antiretroviral agents.
My pregnancy category as an efavirenz is category D. There is positive evidence of human fetal risk based on adverse reaction data from investigational or marketing experience or studies in humans. But potential benefits may warrant use of the drug in pregnant women despite potential risks. As a tenofovir, emtricitabine, and ritonavir, I am category B. Animal reproduction studies have failed to demonstrate a risk to the fetus, and there are no adequate or well-controlled studies in pregnant women. As a raltegravir, I am category C. Animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate or well-controlled studies in humans. But potential benefits may warrant use of the drug in pregnant women despite potential risks. My mechanism of action as a non-nucleoside reverse transcriptase inhibitor is to bind directly to HIV reverse transcriptase to block both RNA and DNA-dependent DNA polymerase activities, which inhibits the viral DNA of transferring information to the cells and reproduce. As a nucleoside reverse transcriptase inhibitor, I compete with naturally occurring nucleosides but lacks the substance needed to extend the DNA chain, resulting to failed reproduction of viruses. As a protease inhibitor, I am used as part of combination therapy for the treatments of HIV infection. And lastly, as an integrase inhibitor, I inhibit the activity of virus-specific enzyme that prevents the formation of HIV-1 provirus, which will lead to decrease in viral load and increase in active CD4 cells. I am absorbed rapidly from the GI and is bound to plasma proteins. I am metabolized in the liver and excreted in your urine and feces. As an efavirenz or other NNRTIs, I am indicated to treat patients with documented AIDS or ARC who have decreased number of helper T cells and increased opportunistic infections. I also have contraindications. I should be used with caution if the patient has hepatic dysfunction or severe renal impairment. I am contraindicated to patients with known hypersensitivity to any of my components. And also, if the patient is at risk for rhabdomyolysis or myopathy and during pregnancy. My adverse and side effects as an efavirenz are nausea, vomiting, indigestion, confusion, forgetfulness, feeling anxious or agitated, and difficulty falling asleep or staying asleep. As a tenofovir, I can cause weakness and lack of energy, headache, diarrhea, nausea, vomiting and intestinal gas, and on more serious side effect, I can cause liver or kidney failure and pancreatic disease. As an emtricitabine, I can cause headache, dizziness, nausea, indigestion, stomach pain, skin discoloration, and changes in the shape or location of body fat. As a ritonavir, I can cause general weakness, burning or prickling sensation in hands and feet, stomach pain, diarrhea, constipation, indigestion, flatulence, nausea, vomiting, loss of appetite, change in sense of taste, insomnia, throat irritation, rash, sweating, increased bleeding in patients with hemophilia, high sugar and fat levels in blood, and worsening of diabetes. And lastly, as raltegravir, I can cause diarrhea, stomach pain, heartburn, insomnia, abnormal dreams, depression, and headache. Here are the nursing responsibilities that you should consider upon administering me to the patients. Assess for any history of allergy to antivirals, renal or hepatic dysfunction, and pregnancy or lactation. Perform a physical assessment to establish baseline data, assessing my effectiveness. Assess level of orientation and reflexes. Examine the skin to monitor adverse effects. Check temperature to monitor for infections. Teach the patient about my prescription and provide safety precautions if CNS effects occur. Monitor hepatic and renal function before and periodically during therapy. Ensure that the patient takes complete course of the drug regimen and takes all drugs included in a particular combination. Monitor nutritional status if GI effects are severe, and advise patient to stop using me if severe rashes occur.